to Healthy Living on Asset Television. You're welcome. With me today is the Commissioner for Health and Human Services, Benue State, in person of Dr. Marcellinus Yanma Otesha. Sir, you're welcome.
Thank you very much.
So on Healthy Living today, normally this is a program where we have to let you know more about health issues, where you learn more about what's happening in the country and in the world concerning health conditions. So stay back and listen to us as we present this program today. We'll take a short break and we shall be back shortly. Healthy Living on Asset Television. So, sir, as the Commissioner of Health in Benue State, what's your role like in that aspect, sir?
As a commissioner in Benue State, your role is to assist and advise the Executive Governor of Benue State on issues concerning health in the state. You are in policy making and also looking at the implementation of those policies.
Beautiful, sir. That's nice. Lately, I think if I followed one of your press briefing where you were saying Benue State, around the North Central region, Benue State has one of the highest prevalence of tuberculosis. So far, what's Benue State doing about this issue of tuberculosis?
Well, tuberculosis, Benue State in the North Central Nigeria is the first in terms of prevalence, highest in the North Central, but it is the sixth in Nigeria. That means it is very common.
Yes.
As a state, partners, especially Global Health Fund, has done so much in assisting us in combating this menace. We have personnel in all the 23 local governments in Benue State with centers whereby most of the people diagnosed, they come there and collect drugs free of charge. Recently, we were given a mobile X-ray machine that was able to move around the local government to take sample and also take shots of X-rays, which we were able to diagnose accurately. That has earned Benue as the best diagnosing state in Nigeria.
That's beautiful.
His Excellency, the Executive Governor of Benue State, Reverend Father Dr. Hyacinth Alia, has taken the head of his people as his topmost priority. So when he came in May 29th, 2023, the first focus was to see that we look at the topmost tertiary institution in the state, which is the referral center, whereby from the primary health care to secondary health care, then the terminal point is the tertiary institution, which is our teaching hospital, the Benue State University Teaching Hospital. 2 or 3 things to assist the people of Benue State. One, to have a referral system whereby they will receive their medical care. The second one, to prevent them from traveling out of the state in the area of high transportation costs, accidents on the road, and going to seek for accommodation where they will stay in other places and get their medical attention. So it is also a reference center for our TB cases, those complicated ones.
Okay.
We also look at the manpower as the problem of diagnosing and managing this.
Yes. In fact, I was going to talk about that because I know there are always shortage of manpower, doctors, nurses, and all that. So what is really being put in place to kind of alleviate that shortfall?
Human resources for health is a problem
All over the world.
all over the world.
Yes.
And Nigeria is not an exception, Benue is not an exception.
Beautiful.
In most of our general hospitals, we have just one doctor per general hospital, except for 5
Okay.
that we have 2 doctors.
Okay.
So when we came on board, we developed a plan, a program called Clinical Medical Student Bond Scheme.
Good. Yes.
The Clinical Medical Student Bond Scheme is a program whereby our clinical students of Benue extraction
Yes.
from 400 level, 500 and 600 level, they are paid a certain amount of money, as much as 100 and something thousand per month.
Wow.
After their graduation at NYC, they
Okay.
will come back and work for us for 2 years.
Beautiful.
In that case, we'll have surplus,
Yes.
at least the much that will man our general hospitals. So our secondary health care
Yes.
will also be boosted
Yes.
with
Wow.
a lot of business.
This is really encouraging. I'm impressed to see this because I think Benue State is one of the only states that has really integrated this aspect.
No, it's not only Benue State, because I have been interacting with some of my colleagues in other states.
Okay.
Government has a program whereby once you are admitted into medical school,
Yes.
they place you on
Salary.
salary on a
Yes.
certain grade level
Yes.
and keep moving until you graduate.
Exactly. Wow, that's beautiful, sir. I'm happy that it has come home like this, meaning that there are opportunities that there is every likelihood sick people that go to the secondary
Healthcare.
healthcare facilities will have adequate and professional attention. I'm impressed to hear that, sir. I know Benue State has lots of issues of IDP camps. You know, they have because of all those displacements from some of those crises. So you can't run away that there must be issues around the IDP camps. How is the health facilities there because of for those IDP displaced people? And then do they have regular medical attention from professionals? And then maybe like the environmental services within those areas? How is it being attended to?
Well, I must say thank you to our partners, our development partners, that have done so much in that regard. And they complement what the state government has on ground for the IDPs, because they have medical facilities and institutions in almost all the IDPs, IDP camps.
Okay.
And when one develops a case that cannot be handled at the level of the IDP camp, they send them to the federal makers, the Benue State University Teaching Hospital in Makudi,
Yes.
where in most cases the government foot the bill
Oh, good.
of those
Wow.
IDPs.
Okay.
That has run for
Yes.
well, in fact, even before this government
Okay.
came into power.
Because I was always wondering on that particular aspect, you know, because I know unfortunately Benue State encounters such disasters, but I'm really impressed to hear this. So going forward, when there are emerging diseases too, do you have teams that go to visit to take samples just ahead? Okay, like there are times recently there was outbreak of cholera around the country. How was it really handled? Because I've known you in some aspects of medicine, you know. I follow you up and I see that you're a very proactive person. So in the case of early detection, what is done about this?
Well, our emergency operations center, headed by the state epidemiologist, is very active. Before the cholera, we had an outbreak of Lassa fever in the state. If not the proactiveness of the center, honestly, I don't know what could have happened. The first and foremost, His Excellency, the Executive Governor of Benue State, has a lot put in place for us, like assisting us with vehicles and other means to take samples, send them to Abuja for diagnosis. Our team, we went to RDP camps. I was there myself in one of the RDPs, whereby we enrolled most of the vulnerables, even though all the people in the RDPs are vulnerable people.
Yes.
But that group also have vulnerables. So we describe them as vulnerables and the vulnerables.
Wow.
That is the old people, the under 5, the pregnant women, which we enroll them on the federal government program,
Okay.
which 1% of consolidated salary revenue is pushed into a certain quarter called Basic Healthcare Provision Fund. We enroll them on that program. Way over 52,000 of them were enrolled on that program, where once you have an issue, you go to the clinic, you are given drugs free, your basic tests are done free for you. And with the assistance of His Excellency, the Executive Governor of Benue State, we were able to combat Lassa fever because Benue State University Teaching Hospital became our referral center, which was very active, and most of the cases were managed very well. We had issues whereby those that develop complications had to be taken to UA in those states, and most of them, those taken there, died as a result of acute kidney failure. But graciously, the present DG of National Center for Disease Control graciously donated a very big dialysis machine to us, which has been installed at the Benue State University Teaching Hospital, whereby people, those affected, are undergoing dialysis and will have less of fatality. For the cholera outbreak, our team too swung into action, and that's why we had very little of mortality in the state. And now we are on with Mpox.
Mpox,
Yes, 4 cases have been confirmed, and in fact they are doing very well.
Good.
As a matter of fact.
Thank you very much. Viewers, for now we'll go on a short break and we'll be back shortly. Viewers, you're welcome back to our program, Healthy Living. With me here, we still have the Honorable Commissioner of Health of Benue State, Dr. Marcellinus Yanma Oteshe. So, on the issue of maternal child mortality case, how is it? Because I know Benue State also has a high prevalence of maternal child mortality. What's Benue State putting into place concerning that aspect?
But the target of the federal government, any government at all, is to crash down the maternal mortality, maternal and child mortality, because it is quite unfortunate, and one should not be forgiven to hear that a woman dies in pregnancy, in labor, or during course of pregnancy. The primary health care was actually brought in place to check those funny, I would describe them as funny and sudden deaths while a woman is pregnant.
Yes, you just said something. That primary health care centers, particularly Nigeria's case of primary health care center, if I take it to take it as a case study, it's nothing to really write home about properly now. But in Benue State, what's going on with the PHCs, which is supposed to be the real primary place where our first port of call for any medical case is? What's it like in Benue State?
No, a lot has been done in this very first 1 year of His Excellency's administration, because when I came on board, I actually took tour of most of the primary care, which are being supported by the Basic Care Provision Fund. There are about 276 in Benue State, which represents the political wards. Every political ward has a primary care that is supported by this program. And we discover why the patronage has been so poor. One, their complaint is that they are very poor and vulnerable people. So once they get to the hospital, they'll be asked to pay 2,000 or 3,000 before they take delivery.
Yes.
And we discovered that if government could provide basic amenities like those things which they are very necessary during childbirth, we call them mama park, the attendance will be very fine, because most of the things done will be free, which they have been supplied in almost all the 276 for now.
Do they have opportunity to have the vaccines there too? Some of those child vaccines.
Yes, for every viable primary care must have a good maternity station, must have a good immunization outfit, must have a good consulting room, will have those basic things that you walk in as an adult of any or a child. You should have your blood pressure, you have your sugar tested.
Yes.
That is the non-communicable diseases, which is also killing a lot of people silently. So now the federal government through the World Bank are assisting our primary care, not just only in Benue State. Now we want to upgrade our primary care to what we call level 2 primary care. And this level 2 primary care is where a woman walks in pregnant and come out the baby.
Yes.
And the baby is fine.
Now, really well in this country.
And what very soon, in fact, almost all the 36 plus Abuja, we have World Bank assisting this primary health care. Very soon, contracts to expand, provide solar light, water, and a mini quarters.
Okay.
The reason why there should be a mini quarters is that at any time you access the clinic, you must have somebody present who will attend to you.
And is this almost being done too in the secondary healthcare, with your own location?
Yes.
Okay.
Yes, there is another program again, which we are still working on. That one too is through World Bank. The comprehensive emergency maternity and maternal and neonatal child care, where they are going to renovate and improve on the facilities in the maternity unit of the general hospitals. I think that will it's going to assist in the management and care of the maternal and child mortality in the country.
Wow.
Not only Benue State.
Wow. It's been wonderful having the Commissioner for Health. He knows his job. You will agree with me. Because this is very insightful. For those of you watching us, you see that Benue State is really coming up in this aspect of health management and health services in Benue State. So, sir, to round up, is there anything you would need to tell us about advise us and tell us more that will entice more people to be interested in going for maybe medical pilgrimage in Benue State within Nigeria?
Yes, I started by saying that we first look at the teaching hospital as a reference center. fact, we want to make it a one-stop hospital. Recently, we have launched the cancer center in the state.
That's
and
nice.
in fact, we have generated certain amount of money with the assistance of His Excellency, the Governor of Benue State. We have mapped up those people that we send for training, ranging from the doctors to the laboratory scientists, and those in the X-ray, the radiology unit.
That's true.
Because there are no many oncologists in the state, and we must take that bold step to make sure that we train them, and all the equipment who will supply from the manufacturer itself has been mapped up by His Excellency to do that. We graciously, the last administration, scrapped up the School of Nursing and Midwifery. So graciously, within this 1 year, we have not only resurrected the School of Nursing, but we have also gotten an approval and accreditation to the level of College of Nursing and Midwifery Sciences in the state. With that, we'll have a lot of manpower and from the stock that we can pick for use at any time.
This is
so that's the little, just little of what I can give you or what is happening in Benue State as the health sector is concerned.
Thank you very much, sir. Thank you very much, Honorable Commissioner. It's really been wonderful. In fact, I think I learned that some of my colleagues too are coming for some projects from here. So I think we will come to Benue State to see what Benue State is doing together, and then we will learn more from you.
You are most welcome.
Thank you very much. Dr. Marcelino Ziama-Oteshe is the Honorable Commissioner of Health and Human Services in Benue State. He has actually brought us into lots of insights in what is going on in the revolution in the health sector in Benue State. So with this, as much as possible, some of us can still visit Benue State for good medical services. He made mention of the oncology unit that is coming up, that's for cancer. So for those of us that may be having issues of cancer or have cancer patients or relatives, with time, I think you really have to visit Benue State instead of running out of Nigeria. So we thank you for watching us on Healthy Living on Assets Television. We hope next time you will join us as we welcome another guest with us. Thank you very much.